A little over a week ago, a coalition of organizations came together and announced they had eliminated $35 million in medical debt for over 23,000 Arkansans. The leaders of two of those organizations involved, Dr. Sherece West Scantlebury, CEO and president of the Winthrop Rockefeller Foundation, and Abby Hughes Holsclaw, senior director for the Asset Funders Network, joined me for a conversation. All right, Sherece, I'm coming to you first with this question. Tell me how this consortium of groups came together to negotiate this medical debt elimination. This seems like it was kind of a big undertaking. That's a lot of money and a lot of groups.
This is not the first time that foundations or philanthropy has come together on major issues in our state, whether it's the census, whether it's around immigration, whether it's around our Alice families. We actually work together often, all the time, for these types of big systemic change initiatives. So coming together was pretty easy to do. But for this particular opportunity in working with the RIP folks, Abby has been our primary organizer through the Arkansas Asset Funders Network. So doing so was just pretty easy for us to do because the networks and the infrastructure already existed to do so.
Abby, I'm not sure if I've heard of a project like this before. I think that there has been, just because RIP didn't be created out of thin air for just this initial project here, but what's the history of that group?
So RIP Medical Debt is a national nonprofit organization that buys medical debt on the secondary market. And I think for several years they've been doing this, and they have state campaigns, and you'll see announcements in Georgia about medical debt payoff and others. But the Arkansas Asset Funders Network became interested in leveraging their expertise and working collectively with them, because we knew that Arkansas ranked second in debt and collections nationwide, and that this topic of medical debt was so important and so crippling, especially for Alice families in our state, asset limited, income constrained, employed, communities of color, and individuals who just simply are who are earning lower incomes. And RIP Medical Debt has a process by which they buy the debt at a much discounted rate, and they raise money through philanthropic sources, individual donors, and others, and they pay off that debt. They literally buy the medical debt, pay it off, and send letters to the individuals that would be impacted. And there are no strings attached. You simply receive a letter in the mail. And so the Arkansas Asset Funders Network, and specifically the Winthrop Rockefeller Foundation, HOPE, and the Arkansas Community Foundation, put dollars together to add to the Arkansas campaign.
So medical debt's obviously a big issue for a lot of the communities that you work with, but there are much other issues as well. Does this kind of get this off the table for some of those people in these communities around the state? Kind of what's next priority in terms of the way you look at this?
So really for us, the next priority is how do we develop public policy that addresses this in the long term? So to pay off debt is a great thing to do and important and necessary for our Alice families. Really what is most important though is ensuring that our state, and even federally, but even our state, that we have policies in place that protect our Alice families, that enable us to mitigate any future medical debt and to just pay down significant debt for those who are experiencing this. So it's not that it's one issue after the other after the other. The medical debt is here, and it is one in which it's important to address. So I don't want to give the impression that we've done this great thing and now we're moving on to something else. This is an ongoing policy issue. So while the paying of the debt demonstrates this can be done, it demonstrates that through pooling resources, through philanthropy, but there are other ways in which it can be done, but through pooling resources, we can actually buy down that debt. But for our Alice families, the challenge is that their incomes are not keeping pace with inflation. That and if the incomes kept pace with inflation, maybe there would not be a need to pay down the medical debt. But there is also public policy in place that we need to address. So for us as a funder, it is not just stopping at paying this medical debt, but it's actually the long-term process of ensuring that there's public policy in place that does not adversely hurt ALICE families any further.
What a great segue to my next question. And Sherece, I'm going to let you start on this, and then Abby second. Let's talk about what some of those policy goals or initiatives could be. Give me a handful, 2 or 3 or 4 things that you think are in the works or that you want to see happen that you think will need legislative action.
Sure. So a few of those that are in the works are, and also that still need some continued action, is the whole, No Surprise Act that we've probably heard so much about. And that is that the third party, requirement to pay those in-network, out-of-network costs that can be a surprise to so many families. And, you just kind of, this bill just shows up, that there's a way in which that can be done so that you're not receiving non-emergency, that you're not receiving a bill as a surprise, but that it's all packaged in such a way. So there's this No Surprise Act that's slated for implementation, I think, Abby, in 2022, I think it's this year, where patients will only be required to pay for the in-network costs. So that's one example. The other is that these are medical debt can be some of the most aggressive and abusive collection processes known. And there's ways in which we can protect our consumers so that, so that garnishment isn't an issue, so that they would not have to be abused by credit agencies is another example. And just, broadening federal protections around wage garnishment as it relates to medical debt are just a couple to name.
Abby, how about to you, either build on what Sherece just mentioned or also perhaps tell me, how do you go about educating consumers about their options when it comes to medical debt and some of the other things that are affecting ALICE families?
Mm-hmm. Well, building on what Sherece said, I think it's one of the ways that our partnership with RIP Medical Debt, with the funders at the table for Arkansas Asset Funders, Arkansas Community Institute, HOPE, and the Arkansas Community Foundation is, from the beginning, we said we were very interested in raising dollars to pay off this debt, but that it had to be coupled with policy recommendations and action. And that is truly our number one goal. And that is to change the policies and the systems that are trapping people in these debt cycles to begin with. The average payoff for an individual of those 24,000 people touched in Arkansas was just less than $1,500. And to you and me, that may seem very easy to tackle, but for so many families, especially ALICE families who are barely making their budget work, it is literally crippling. So some of the additional policy recommendations that I would highlight include, making sure that medical debt elimination and protections are part of the state's COVID-19 recovery plans. We know that people are just continuing to grow their debt as we've been in this pandemic and folks have needed care. In addition, our work and focus wasn't just on medical debt, it was also on court cost, fines, and fees. And there's a variety of ways that our leaders, whether they be local or statewide, can do a lot more to help ensure that consumers aren't falling prey to a variety of debt traps. Those include identifying local fines and fees that could be eliminated, implementing a no suspension on driver's license for failure to appear or pay fines, and amend the state's debt collection laws to be more favorable for consumers.